Hello class, hi professor. We're group 5 presenting Italian Americans and cardiovascular disease. My name is Ariana.
My name is Nairi.
Sabab. And I'm Christina.
So to get started, we have an overview for you. We're starting with the target population, the barriers to healthcare this population has, current interventions, who is involved, and lastly the recommendations we have. Next we have our icebreaker. Neri, take it away.
Alright, so our icebreaker is going to be 2 truths and 1 lie. Based on the information on the screen, we're going to determine which one is the lie. So less than 20% of Italian Americans are vegetarian. Italian American leading cause of death is heart disease, or Italian Americans prohibit smoking. So the lie would be Italian Americans prohibit smoking.
Did you get it right?
Our second 2 truths and a lie is going to be their main source of energy is carbs and fats. The leading cause of death is stroke, and Italians are free to discuss sex and mental health openly.
What do you think?
The answer is Italians are free to discuss sex and mental health openly.
Good job.
So, Italians first began coming to the U.S. in the 1800s, and there are about 17 million that live here, which is about 6% of the American population, and 49.5% of those are male, and 50.5% are females, and they started to adopt the American cultures and beliefs, like the American holidays. So in the 1900s, alcohol was used as a medicinal source, and Italian Americans still currently believe in home remedies and traditional practices to cure any sickness, and they also view them as a supernatural cause. So Italy offers its citizens with universal healthcare coverage that is mostly free of cost, and the quality of care is better than that of the U.S. The current cost of healthcare in the U.S. is 17% of the national gross domestic product, and Italy's is only 9%. So the most significant health problems are obesity, hypertension, thalassemia syndromes, coronary heart and artery disease, and fanatism. The most prevalent is coronary heart disease due to the Italian diet that mainly consists of foods high in carbs and fats, and the diet also places stress on the heart due to fat and plaque buildup in the arteries.
So we will be discussing the barriers to healthcare. So what are the barriers to healthcare? I'm going to start off with a quick statistic for you. According to Healthy People 2020, barriers to accessing health services leads to needs not met, interruption of obtaining care, failure to get treatment, financial issues, and avoidable hospital visits. So the barriers I will be discussing include, but are not limited to, immigration status, socioeconomic status, language, education, and stigmas. So the first barrier I will be discussing is immigration status. Italian Americans face the access to healthcare due to laws denying healthcare without documentation. Their access to healthcare is limited due to the fear of deportation. Eligibility contributes to immigration status. For healthcare and or citizenship, there are required rules or documentations to receive healthcare. Eligibility not only applies to immigrants but migrants as well. Immigration status also stands as a barrier for migrants because of the expiration of their legal migrant status. Without insurance and lack of migrant and immigration status, access to the healthcare system is even more difficult and can have detrimental effects on the quality of life. Next is our barrier of socioeconomic status, specifically income and occupation. Without income, Italian Americans lose access to housing, education, and healthcare. Loss of income leads to the loss of health insurance services, hospital visits, and emergency services. Occupation is a barrier for Italian Americans. Evidence has suggested that unemployment and the length of unemployment makes an impact on health status. If the source of income and occupation are no longer present, neither is the income for access to healthcare and healthcare services. Occupation Education and income go hand in hand for Italian Americans, and they're accessing and receiving healthcare. Education. Education contributes as a barrier for Italian Americans with accessing and receiving healthcare. Many Italian Americans came to the U.S. with very minimal education. There was a scarce percentage of the population that received a college degree. A study showed that 50% of Italian Americans are not high school graduates. 66% of those with poverty level did not receive a high school diploma. Most Italian Americans have a low level of education because they were primarily taught to farm. Having a high school level of education, issues such as knowing how to talk to your doctor, how to properly apply and access insurance, how to properly read and take prescriptions are presented. Our next barrier is language. Italian pioneers journeyed to the United States in the 20th century, never established English language skills, and potentially may need interpreters for translations. Interpreter services are not available in healthcare settings. With this language barrier, patients cannot follow medical instructions, list their issues and symptoms, or properly communicate with their doctor. Lastly is the barrier of stigmas. The topics of sex or mental health issues are seen as taboo or forbidden. As members of the population follow these stigmas with fear of being different, they are impeding in their access to healthcare services. Stigmas affect the search for treatment, receiving treatment, or even discussing any medical issues. With stigmas, Italian Americans keep more information to themselves out of fear, further hindering their quality of life. Stigma causes of physical, social, and mental harm to Italian Americans. Although the threats of these barriers are important, finding the solutions is imperative.
So now I'm going to discuss strategies. And some of the strategies included are Obamacare and worksite interventions to increase awareness on nutrition, physical activity, and the Affordable Health Care Act. And when identifying the health issues among Italian Americans, it is important to look at the healthcare system of the United States to that of the Italian healthcare system. In Italy, free medical care is granted to everyone, and when Italians from that country come to the U.S., it is a complete culture shock. Barack Obama is a strong believer in affordable health care, and he created Obamacare, which is essentially an affordable health care insurance plan. Since March 23, 2010, Obamacare has been implemented in the healthcare system. This by far was one of the greatest laws passed in history, as it helps populations such as the Italian Americans to receive health care regardless of social class. To combat the risk of cardiovascular disease, a worksite intervention has been put in place. This intervention implemented was focused on nutrition and physical activity practices. Each individual in the program received individual counseling based on the presence of risk factors, and recommendations were given to each individual. The recommendations were in regards to nutrition and physical activity. The intervention methods included nutrition education, physical activity practice, and affordable health care awareness. We recommend having educational courses.
So moving on to key persons, people who service this target group's needs. One group I found was the European Heart Network, known as EHN. They're an association devoted to fighting heart disease and stroke among all Europeans, as well as providing support of patients. Health issues related to heart disease lead to premature death and disability among Europeans. The EHN promotes preventing and decreasing cardiovascular diseases by networking, advocating, capacity building, patient support, and through research. Their vision is that all Europeans have a right to live a life free from preventable cardiovascular diseases. So they've been active for 25 years. Again, they're devoted to fighting heart disease and stroke among all Europeans, as well as providing support. They create relationships with other organizations also devoted to heart promotion and cardiovascular disease prevention. They influence policymakers in favor of a healthy lifestyle, create relationships with similar groups, and build community capacity. So next we have the EHN's core values. So mainly independence. So they're a nonprofit organization independent of political parties, commercial, and other economic interests. Second, their core value is ambition. So the EHN strives to create an environment throughout Europe in which the healthier choice becomes the easier choice and which offers the best possible medical care and support for patients in Europe. Lastly is inclusiveness. So they welcome all organizations that share similar goals as them. Second, I found the European Society of Cardiology, known as ESC. Let's see. They were established in 1950. They aim to promote prevention, diagnosis, and control of cardiovascular diseases among Europeans. Their mission is to reduce the burden of cardiovascular disease, and they also aim to promote prevention, diagnosis, and control of cardiovascular disease among Europeans. Through networking, they're able to communicate the universal cardiology community. So moving on to their code of conduct. So volunteers must be honest and ethical. Also, they must maintain confidentiality. They must deal fairly with collaborators, provide members with proper information, proactively advocate moral behavior, protect and assure the proper use of society's assets, and lastly, forbid any improper or deceitful influence. So next, moving on to the recommendations we have.
For our recommendations, we recommend having educational courses and where a health educator that speaks Italian could guide members of the population in accessibility to healthcare, with educational classes that can be held in community recreation centers. Members of the population have the time to ask questions and gain knowledge that improves their quality of life. This intervention would be very straightforward, and it would discuss the benefits of an interpreter, the cost of an interpreter, and where to find an interpreter. This information would be all conveyed through a PowerPoint presentation and a health educator that speaks Italian. Additionally, there would be an interpreter that presents at this intervention, so the participants can voice any questions, thoughts, or concerns. And our recommendations also include marketing strategies that include the public service announcements and brochures and flyers. The PSA would inform Italian Americans about heart disease and its consequences, and the brochures and flyers would have information about free health resources they can utilize.
So next we're going to be talking about our event interaction.
So for our event interaction, we visited the Italian Museum in Los Angeles. It discussed the history of Italians from when the Italians first migrated to the U.S. up until today. And some of the displays we saw included clothing, paintings, passports, and legal documents.
Here are some pictures we provided for you from the museum. So we have the Italian Mafia here. The museum was held in the Italian Hall, and John Fonte, who was born in Colorado, is an Italian immigrant, and he was very deeply religious. He moved to Los Angeles in 1929 with the hope of becoming a writer, and he ended up publishing a semi-autobiographical masterpiece. Here are our references. Do you have any questions?
Thank you so much, class. We hope you enjoyed our presentation.